an engineer. I'm an adolescent physician that works at the Hut in Wellington, and this is Jessica Allen, who's one of the registrars. We have an interest in adolescent health. And this morning we're going over these kind of two separate sections to things. There's one a bit about adolescent development and some things that, just some concepts and some things to think about for that. And then there's a bit where we do a little bit of some scenarios and different situations to go over some areas of adolescent health. And then we do the HEAPS assessment stuff at the end. And we will have a break in the middle at some stage, depending on when we get to it, what time. Okay. So, just ignore some of these slides. So if I was getting, don't even look at that one, that's not what we're talking about. If we were going to define what an adolescent is, how would you define the period of adolescence?
In between childhood and adulthood.
Yeah, in between childhood and adulthood. Yeah, that would be correct. Is there any way that, how would you define what childhood and adulthood are then? Or what that period is?
High schools.
So if you go to high school, you're an adolescent?
Is it to do with gaining a bit of kind of, not responsibility, independence, but you're not quite completely independent?
Okay, so yeah, so that could be a bit about how you interact and how you can get about doing things. You can be sort of independent. But any others?
Does puberty fit into one of it?
So you could have puberty, so as in when puberty starts, how would you say when it ended?
I was thinking more for staff, like.
Right, for start, yeah. Yeah, okay, could be. Can anyone see any problems with the puberty one? Yeah, you know, like some kids go into puberty at 7, you know, girls that is, usually not boys. And some don't start going into puberty till they're 14, 15, so that's a huge variance in when that might start, isn't it? So, I mean, people used to use that to define it, certainly, but I think now that's a bit difficult. And some people never go into puberty for other reasons, so do they never become adolescent? Yeah. Any other ideas?
Social and cultural norms, rather than you consider them adolescent?
Yeah, because I suppose it might be quite different in some areas of the world, mightn't it?
Well, the word doesn't even exist in those cultures.
Yeah, because you're just a child or an adult, aren't you? Yeah.
So it's quite a Western construct.
Yeah. So as you can see, there are quite different ways, and I think that's important. If you were to ask Maori what the definition of adolescent is, and this has probably changed over time, it's quite different as well, and like I said, because of cultural means. But I think the ones that we really want to look at is the World Health Organization ones, just so that you've got those. So they use 10 to 19-year-olds as being adolescents. So it kind of fits in with that age group that we're thinking of, but it's nice to know what they use for their definitions. And then they use 15 to 24-year-olds as youth, and then 10 to 24-year-olds as young people. So all of you are still in the young people category, or some of you getting too old? Hands up all the young people. We've still got some young people? Excellent. You're not young. And I mean, it's not so much a problem now, but we used to have very different ages that you could do different things at. So up until recently, you know, the drinking age, as you guys probably are more aware of than me, you know, used to be a bit higher, and so you used to be able to do all sorts of things at 18, but not drink 20 and stuff like that. So, and around the world, there's still some quite funny discrepancies in those sorts of areas, particularly that you can go to war and fight for your country, but not do some other things quite often in other countries. How old do you need to be to get married in New Zealand?
18.
Okay, you can at 16, but what's the...
Only with the parents.
Yeah, with your parents' consent. Yeah. Otherwise 18, yeah. Okay, so what has been traditionally used is, as you said, the developmental period between childhood and adulthood. So very good. Usually beginning with the changes of puberty, but obviously there's problems with that, and ending with the what we call the assumption of adult roles and responsibilities. Now, what does that mean?
Student loan.
Getting a student loan. So if we look at this kind of thing of what people have tried to put there. If you went back to the 1940s, which I can't because I'm not that old and neither can you, but thinking what you think might have happened with people in the 1940s, what would be different about puberty and the assumption of adult roles compared to now?
Probably happened closer.
Yeah. So, you know, people say puberty in girls was 13, 14, say. I'm not sure we exactly know, but, you know, probably was somewhere around there. And when would they all of a sudden have adult roles and responsibilities if you're a girl?
Like a pregnant.
Sorry?
Pretty much as soon as I got pregnant.
Well, as soon as you got married or whatever that is, yeah, so, you know, 18, 19, you know, maybe even younger, but we'll make it, you know, kind of nice. And some of them were older, but say that's kind of what typically could have happened. Some of them it was in their 20s. I'm sure my parents didn't get married at 18, so. But it's certainly younger than now. So what would be the typical thing now? Changes of puberty in a girl, what sort of the average age? I'm saying girls because it's just a lot easier to measure. Guys, it's a little bit. So, you know, like 10, 11, sometimes even a bit younger than that, but probably averaging around 10. And the assumption of adult roles and responsibilities?
30.
Oh yeah, it depends what you consider that being. If it's getting married and having children or having a full-time job or supporting yourself. You know, for some people that happens very late in life, you know what I mean? You can see that although traditionally that's what's thought, there's huge problems with that definition. And some people have been looking at, well, what's happened with this changing of how long we spend as being an adolescent. You know, how does that affect society and what happens in society? So it used to be this short, compact period where you had to get all that stuff over and done with, and now it's kind of this broad, lengthened out period. And so some people have some different research they're doing about that. And some people have suggested that things like binge drinking and all those sorts of things are a result of us kind of lengthening this period of adolescence. Whether that's true or not, I suppose we're not really going to be able to prove it, but certainly some people are looking at that. How does society change when you give people this long period of adolescence where they don't have so much the adult responsibilities and they're going into puberty at quite an early age? So that's just something to think about how it's changed over time. So the next bit is a bit about all the different things that might impact on a young person that you're seeing. So for instance, if you're looking at a young person, it makes sense to say that usually they're part of some sort of family, not necessarily traditional family, but some sort of family. There's usually a community that's involved, there's a peer group, and there's some sort of school training or work. So something around that's around them. So that's kind of thinking of a young person, you know, who do they live with, who are their family support people, what community are they living in, where are they going to school, what are their friends. But then there's the bigger things, and in New Zealand we have the Treaty of Waitangi, which should inform us a little bit about, well, a lot probably, about how we're looking at adolescence. But then there's things like international obligations. Can you think of something around children and young people that New Zealand needs to kind of... Yep, so the United Nations Convention on the Rights of the Child, yep. So that's one thing that kind of talks a lot about when you stop being a child and when you get adult responsibilities and some different things about what your rights are and things like that. And then there's different values or belief systems and obviously economic and social context of where you live. Now, as you can imagine, if you grow up in Afghanistan at the moment, this looks very different than if you're growing up in New Zealand today. But even if you look in New Zealand, can you think of some different examples of where this might look quite different just within the Wellington area?
The difference between Victoria youth and Nino youth?
Yeah, so just the things that are impacting on young people and the beliefs of the community around them and the culture of the community around them might be quite different growing up in those different areas. And that doesn't say one's right or wrong, but there's different things underlying what happens in that culture. And being aware of that, you know, the belief in a community around them can impact on what's actually happening for a young person as well. So it's not just the young person and their family, it's the other stuff. And sometimes it's not even the belief, it's the socio-economic stuff that means that they don't have as many places they can go and play rugby or whatever, you know. So there's a whole lot of different things to kind of be aware of and think about. So with that, if we're looking at when you're entering adolescence, we're going to look at early adolescence, middle and late adolescence. If you had to kind of describe someone in early adolescence, don't all look at your paper because if it's in there or not, but even if you don't, try and think what would they be like, and we're going to divide it into three categories. What are they like socially? What are they like cognitively or intellectually? And what are they like physically? So social, cognitive and physical. So if you're thinking of early adolescence, which starts at 10, so thinking about that age, what are they like socially?
It's a bit too divide.
There is a little bit, but we'll use gross generalisations here. This is an area where we can for this. Yeah. Who's the most important people in your life when you're 10? Your mum. Your mum or your dad, or hopefully your parent. Yeah. Generally speaking, it still is mum and dad who, you know, are the most important person when you're that age. Yeah. And what's your thinking like, or your cognitive processing? What's your thinking like at that stage when you're 10?
Not really challenging it.
Yeah, so you kind of,
It's gaining more insight. You're starting to gain a little bit more insight, probably.
yeah,
But you're still quite limited and quite like, not so much black and white.
yeah. So we do tend to call them kind of concrete thinkers, like 10-year-olds, right? So they are kind of black and white, and if you say things, they take them seriously. It's quite interesting, and I can't remember how old these kids were, but I remember them being a lot older than I thought, watching TV programs and that they actually think they're real. Yeah, even when they're at an age where you think, surely you must know that's not real. You know? And even the cartoon stuff, you know, thinking that that actually has happened somewhere. So it does make you think, and some of the things about that. So they have, what does that mean though for a 10 or 11-year-old if they're concrete thinkers in terms of kind of getting them to change their behaviour?
Probably quite easy.
Why?
Because you might lie to them, they believe.
We can just talk about right and wrong and things. And
Right.
quite, there's no like blurring of the lines. Like it's either you just don't do something because it's wrong, or whatever. It's not like,
Right.
oh, but I kind of want to do that.
Yeah. What does it mean though if we try and use strategies that are a bit more complex than just at the time saying, no, don't do that? And kind of,
Just lost on them.
so,
Is it just lost on them?
yeah, so think about some of the strategies that we might use with young people. What's an example of some things we might do? So,
Motivational interview.
yeah, but now I'm talking about and you know, just everyday, general day life, what parents might do for a 10-year-old if they've been naughty. What sort of things do they do?
Time out.
So time out, which is an immediate thing, eh? Yeah. So that's probably going to work because it's immediate and it's right there. What are some other things people try and do?
Bargaining.
Yeah, so the bargaining. And when you're bargaining, what are you kind of things do you kind of bring up?
Yeah. It's like positive or negative reinforcement. Maybe.
Yeah. So give an example might be something like, well, if you do this, then and you do this, you know, if you manage to do it for a couple of weeks, then you'll get this. So there'll be some reward. So what's the problem with that?
Too long.
Yeah. And so what we know is that apart from the concrete thinking, they also can't do something called forward planning. Okay. So that's kind of linked where you can actually plan and see things in the future. So the whole thing of the consequences that are not immediate doesn't work so well. So the thing of saying, well, if you do this, you might get this. If it's too far away, like more than a day, usually it doesn't work so well because to them that doesn't work. So we've done social, but what about What was the other area we did? Oh, physical. So at 10. What's the first signs of puberty in girls? Breastfeeding, yeah. And boys? Yeah, so testicular enlargement. So that's the kind of the first. Not that I don't know if many boys notice that, I don't know. But certainly it's a bit harder in boys to know kind of the onset of that. And when do girls have most of their growth? So in early puberty, so before they have their periods. Yeah, which is the last bit of puberty in girls. And boys?
Is that one of the last?
Yeah, so in boys they do their growth towards the end of the puberty. Generally speaking. There's always people that seem to do it different. So we've kind of done this early adolescence. So parents are very important. The questions about am I normal? And they're coming to terms with body or biological changes. So the onsets of puberty, although it could have started before, now this is kind of the average time. And this kind of really concrete thinking. So if you say something, you take it pretty literally. So if this is early adolescence, we're going to now shift to middle adolescence. What's going to change? So if we think about people you're most close to, now this is a little bit tricky, but what changes in terms of parents being kind of the most important people in your life when you get a bit older?
Friends.
Yeah, so I'm not saying necessarily that parents aren't still very important in lots of young people's lives, because of course they are, but then you've got friends who become very influential, don't they? So you've got the peer influences. You're thinking, how does that change in the next little bit? Yep, so you can do abstract and you can do some forward planning. What age does it generally happen? What sort of age can you start doing that? So yeah, so supposedly around age 12, but it is quite variable. And what we know is that if someone's stressed, they're unable to do that. So if they're in, a time when they're afraid or stressed or something bad's happening, which is usually when they're getting told off, they can't do any of that stuff. And we know with adults that 50% of the time most of us don't do this either, when we're stressed. And when anyone's stressed, they revert back usually to, not doing things as well developmentally. And obviously they're progressing through puberty. So middle adolescence, peers are increasingly important. The question of who am I and how do I kind of fit in. But there's this change in developing this abstract thinking and being able to do forward planning or forward thinking. So it means they can start to think about consequences, but remember that whenever it's a stressful situation, that's going to probably go out the window. So late adolescence, how does this kind of change? What changes in relationships again do you think at the end of adolescence? So 16, 17, 18 sort of age.
Is it the thing about seeking more, deep relationships
Yeah.
other than your parents or something?
Yeah, so I think, like you see this thing of young adolescents, parents most important, and yet the whole group of friends, that kind of changes quite frequently, like you can be the friends with this person that week and not the next week sort of thing. And and lots of peer influences to actually then having more stable, sometimes intimate, one-to-one relationships sort of thing. So there's kind of changes a little bit there. So we've got kind of the questions too of, as you probably were all aware, what am I going to do with my life? And how do I fit in? What is my purpose? And a lot of questions around really big picture stuff actually, about, how can I change the world and all those sorts of things as well. And obviously usually at this stage I've completed going through puberty. Kind of makes sense? Yeah. So if we look back in history, there are quite a lot of events that have actually happened because of this stage in adolescence. Can you think of anything like that? Where there's been quite major changes where young people have sort of said, I don't like this, I'm going to do something about it. Yeah?
More protests.
Yeah? Sorry?
Is it all those issues like ethnic things and women's rights and stuff?
Yeah, so a lot of those things actually started because young people said this is not okay, we're going to do something about it. What do you think's different about, because I think this is quite interesting too, if you talk to people that are like 16, 17, and you're talking to them about stuff in the world, you know, big issues, which they can do, what do they think about people that are older, do you think? Yeah, they sometimes think we're boring, yeah.
Close-minded.
Yeah, it's interesting because often they think that we don't stick up for what we believe in. Because we'll go, oh yes, that's right, that's really, really bad that that's happening. But we don't tend to do things the same way they want to do things about it. Because they tend to be really passionate, don't they, and energetic, and going, I'm going to do something. And we tend to do things in a little bit of a different way as adults, whatever that means. And sometimes that's because we might be employed, or we've got to be careful what we say, or we have other responsibilities, right? And so there might be reasons for that, but how do you think young people see that sometimes? Yeah, and so it's quite interesting talking to young people about this, sort of thinking, well, adults just are kind of, you know, they're pretending that they are interested in this. And so you can have some conversations and show how you are interested and can support things. But actually a lot of things that actually get changed in the world because young people are prepared to actually do something about it. And the rest of us like to think we're doing something about it, but sometimes we aren't actually because of the other things that get in the way. And I'm not saying those things aren't important, but it can change how we do things. And sometimes we're not as effective as what young people will be. Not always, but sometimes. So it's just something to think about, and it would be interesting sometime, and I need to do it, because I don't know much history, but going back and seeing all the different stuff. If you look at major world events, most of them started because of some young people. Yeah. Or there was some huge part of them that young people were involved in. Sometimes for good and sometimes for bad, but you know, most of them initially were trying to do something that was good. Yeah. So why is it important? Well, it's important because if we think about things that young people die from or get sick from, they usually have kind of this developmentally based sort of cause. And so if we're going to look at some of those things, we've got to understand development, because a lot of the ways that we try and deal with young people, we use these strategies that are kind of based on how adults think. And if young people are thinking a different way, then they're not necessarily going to work. Does that make sense? So what's some of the things that young people die of? What would be the highest thing you die from in New Zealand? It depends which age group you're looking at, so, and it's almost neck and neck. So suicide is one, and what was the other one? The big one. Yeah, so motor vehicle accidents, and they're kind of very neck and neck depending on which year you look at them. So sometimes one's higher than the other, and depending on which age group, but they're the two big things. Other things, if you were thinking of a young person coming to see you in a youth health clinic, what would be the things that they're coming to see you about, do you think?
Sexual health.
Yeah, so sexual health is one of them.
Drugs.
Yeah, mental health is huge. So depression and anxiety. Yeah. Relationship problems, which don't necessarily fit into any of those. But you know, like had a fight with their friend, or had a fight with their boyfriend, girlfriend, whatever it is. Whatever.
Medical things.
Sorry?
Chronic medical things.
Yeah, so anyone with a chronic illness.
Question.
Yeah. Why me? What did I deserve to get this? And coping with those sorts of things. So someone said drugs and alcohol. So sometimes they do come and see you about that, but usually I must say they're not coming to see you about that. They're coming to see you about something else, but that comes up. Obviously it's a huge issue at times for young people. So say we're going to, I don't know, I suppose the other ones, you said sexual health, so teen pregnancy and things like that. So if we're going to pick one of those issues, pick any of them, besides mental health, because that's too hard. No, pick an issue like teen pregnancy or drug and alcohol or something like that.
What are we doing with it?
Just pick the issue. Can't make it that easy. Okay, so drug and alcohol. So what is a strategy that we've used in New Zealand previously to try and prevent young people from using drug and alcohol?
Advertising campaigns.
Yep, so there's been advertising in terms of, are they directed at young people? There is one at the moment, yeah? The Chuck one.
People that are like around the age of legal drinking, and you can't aim it at adolescents because they're not supposed to be drinking.
Right, right. How about stuff in schools then? Because if we're aiming it earlier, we're talking about prevention at an early stage. Drug and alcohol.
Health.
Go through how
Yep.
drugs and how they're all illegal.
Yeah.
All right, yep. So there's the health education program, yeah?
And there's some like organisations that kind of set schools, yeah.
So SAD's usually one within the school because it's students and drug driving, yeah. And there's DEAR. DEAR. Did you want to go through DEAR? Yeah. Can you remember anything about it?
T-shirts.
So what do you know about programs such as DEAR? Do they work?
What is DSR?
So DEAR is drug and alcohol resistance education, I think. I always forget what exactly it stands for. Yeah, big words that no one understands. So basically it's a bit like a drug education in terms of, you know, drugs are bad and these are the things that could happen if you use them.
Yeah.
Probably like prolongs the time between when they try them and but this probably doesn't change the actual outcome.
Should ask the person that actually went through the DEAR program that can only remember the t-shirts. No. Can you remember anything about it at all?
About what the teacher.
Yeah.
I remember the people teaching us being like, you probably never had any drugs or alcohol in your life. But
Yeah.
they didn't seem, they
They're really not cool.
yeah. They were quite like, I don't know, it didn't seem, because I thought it was like sort of targeted at young people, and it would be young people talking to young people, but then it was, the one that we got anyway was like kind of older people teaching us, and
Yeah.
I was kind of like, no, give it a,
So it wasn't very realistic, you thought, in
No.
some ways, yeah.
no. But it was kind of just fun. I think it was like free time.
Yeah. So there was a little bit of research done on DEAR, and it's interesting, and that this goes for most of the education programs pretty much. We know that young people that have been through a DEAR program are actually more likely to use drugs. Which is a bit of a problem, because if we think we're going to educate people so that they don't do things, it doesn't seem a very useful strategy. Now, why would that be?
Sparks interest.
Perhaps, yeah. There is a little bit of that.
Because kids are kind of like inherently oppositional, so if you tell them not to do something, they're more inclined to do it.
Perhaps, although I'm not necessarily sure that's true. There will be some that are like that, because there's always something going, you tell me, don't you tell me what to do, isn't there?
So is it because the schools in the areas where kids are going to do it are more likely to use DEAR than other schools?
No, apparently they did randomise, you know, to similar schools that didn't have, because it certainly wasn't every school having the same thing. Yeah.
Is it because in the program it almost not normalises it, but it kind of like, because I think they sort of push like an openness about like drug use and things like that. So I don't know if it's sort of
Yeah.
almost
So there is a little
normalised
bit about that
Whereas
that I'm
normally-
kind of getting at. Yeah.
Yeah.
So if I say to someone, don't do something, why do I feel I need to do that?
Because you're thinking they're going to.
Right. Now what does that mean for a young person if I'm telling them don't do something?
Someone's expecting that they will.
So what does that mean in terms of what they might then do?
If they don't do it, then they act normal. Yeah, they're going to miss out on something.
There is a bit of that, but I think there's more about what do I believe about them. If I'm saying don't do this, particularly if I start more than once and they're getting a lot of don't do that, that young person's thinking this adult thinks that I'm going to do this. And what does that tend to happen if over time more and more people tell you, don't do this, and the message you're getting is, I think you're going to use drugs, I think you're going to use drugs, I think you're going to use drugs.
Just say, fine, I'll do it anyway.
Yeah, and there's not going to be every young person that reacts that way, but I think if you don't have a very good relationship with the person that's telling you that, the message is, I don't believe that you're going to do things the right way. And how does that impact on outcomes, do you think? Do you know any research about someone's belief about someone else and how it impacts on what they do? Sounds pretty scary, eh? Well, there is quite a lot of research about this. So I'll give you a couple of examples. So the first one's about young people, so 5-year-olds. And this is nothing about the young person, it's about what the teacher believed about the young person. So what they did, and I think this was a very long time ago because I don't think you get it past ethics committees these days. So what they did is they had a group of 5-year-olds going into school and they randomised them into 2 groups. No difference in IQ, sex, all that sort of stuff. And then what they did was told this group of teachers that this group were going to do really well in their first year. And then the other group, who remember were no different, they told the other teachers, these are just average students. And then they, let the teachers teach them for that year and then did an assessment at the end of the year. How do you think they turned out? Was there any different? Yeah? How do you think it went down?
It's like self-fulfilling prophecy.
It was, in that, the teachers that thought these kids were going to do better, these kids did better that year. Even though there was no difference between them and the group that were average. And of course the ones that the teachers thought were just going to be average students ended up being average students. Obviously there was some variance in the group like everything. But, it predicted how they did in that first year. How does that work?
The teacher could challenge them more because he expects them to be able to do it.
Yeah, so there's something about the teacher's expectations for that young person, in this case the 5-year-old, that predicted that outcome. Which is pretty scary, isn't it? But it makes sense, yeah. And we know it works also in terms of adults. So we know that if you are an alcoholic, for instance, and you come and see a drug and alcohol counsellor, if the drug and alcohol counsellor thinks you're going to change your behaviour, you probably will. If they think you're not going to make changes, then you're not going to make changes, it seems. It's kind of this self-fulfilling prophecy. But it also means that if a young person comes to see me that's struggling with their diabetes, that the things that I might think about them is probably going to predict what's going to happen in that interaction with them, which is pretty scary because we can sometimes have some pretty interesting thoughts about young people. You know what I mean? And sometimes we might have to think, well, why are we thinking that? And if you're having a bad day, you might be having more negative thoughts, Give you an example. 12-year-old that came to see me who had had sex for the first time the night before with someone she didn't know, who was 19. Right. So, immediately what do you think? It's very easy to go, what on earth were you thinking? And what sort of 12-year-old does that, isn't it? Yeah. So what that means is I've got to be really careful how I think about this young person, because if I think about her in that way, my interaction with her is not going to produce anything useful. Okay. But if I think about it in a different way, perhaps there's going to be some impact that might be positive. And we're going to go over some things related to that coming up. So kind of what, if I've got this, we didn't do this. So the key question is thinking about a young person, where are they